Imagine walking into a hospital today. You expect sterile white lights, clean floors, doctors in spotless scrubs, and the comforting smell of disinfectant. Now, erase that image completely. Welcome to the Victorian era, a time when a hospital was not a place of healing but a house of death. If you were sick or injured in the 1800s, going to a hospital was essentially a death sentence. Based on the chilling and fascinating book, The Butchering Art, by Lindsey Fitzharris. Today, we are going to dive into the darkest glitch in medical history. We are going back to a time when surgeons wore aprons stiff with dried blood, when operations were treated like spectator sports, and when the people trying to save your life were the exact same people killing you. Welcome to History Glitch, where we explore the fatal errors in the human operating system. To understand this glitch, you have to understand what surgery looked like before the year 1846. There was no anesthesia, no ether, no chloroform, and certainly no painkillers. If you needed an amputation, you were wide awake. Because the patient was conscious and screaming in absolute agony, the most important skill a surgeon could possess was not precision, but speed. A good surgeon was a fast surgeon. Operating theaters were literally theaters. They were circular rooms packed with hundreds of medical students and curious spectators who bought tickets to watch the bloody show. The air was thick with the smell of sweat, rotting flesh, and fear. Into this nightmare stepped a man named Robert Liston. Liston was a giant of a man, standing 6'2", and he was known as the fastest knife in the West End of London. When Liston entered the operating theater, he would pull off his coat, roll up his sleeves, and yell to the crowd, "Time me, gentlemen, time me!" He could amputate a human leg in under 3 minutes. Sometimes he worked so fast he would hold his bloody surgical knife in his mouth while he used a saw to cut through bone. But extreme speed comes with extreme risks, and Robert Liston is famous for causing the most unbelievable glitch in surgical history. An operation with a 300% mortality rate. The story goes like this. Liston was performing a rapid leg amputation on a struggling patient. He swung his knife so fast that he accidentally sliced right through the fingers of his surgical assistant who was holding the patient down. As he pulled the knife back, the flashing blade came too close to a spectator in the front row, slashing the man's coat. The spectator, believing his own stomach had just been cut open, went into deep shock and dropped dead of a heart attack right there in the theater. A few days later, the patient died of gangrene from the dirty amputation. Shortly after that, the assistant whose fingers were cut off also died of gangrene. 1 surgery, 1 patient, 3 deaths, a 300% mortality rate. This perfectly illustrates the chaos of Victorian medicine. But the real glitch was not the speed of the knives. The real glitch was something completely invisible. In the 1840s, a miracle happened: the invention of anesthesia. Finally, patients could be put to sleep. Surgeons no longer had to rush. They could take their time, perform more complex surgeries, and save more lives. But something terrifying happened instead. Death rates actually skyrocketed. People were surviving the surgeries, but they were dying days later in the hospital wards from a mysterious condition called ward fever. The symptoms were always the same. The surgical wounds would swell, turn black, leak foul-smelling pus, and the patient would die in a delirium of fever. The medical establishment was completely baffled. They believed the glitch was caused by miasma, which translates to bad air. They thought invisible toxic clouds floating through the hospital were rotting the patient's wounds. Because they believed the air was the problem, they completely ignored the true killer, themselves. Surgeons in the Victorian era had absolutely no concept of germs or bacteria. They believed that a doctor was a gentleman, and a gentleman's hands could not possibly be dirty. They would go straight from dissecting a rotting, infected corpse in the morgue to delivering a newborn baby without ever washing their hands. They wore their blood-soaked surgical coats for years without washing them, treating the layers of dried blood and pus like badges of honor. They would drop a surgical instrument on the dirty floor, pick it up, wipe it on their bloody apron, and put it right back inside a patient's open chest. They were unknowingly planting millions of deadly bacteria directly into vulnerable human bodies. The glitch was a fundamental misunderstanding of biology. But every glitch eventually meets a programmer who knows how to fix it. And in this story, that programmer was a young, quiet Scottish surgeon named Joseph Lister. Lister was deeply disturbed by the massive death toll in his surgical wards. He refused to accept that ward fever was just bad air or an inevitable act of God. He started looking for clues, and he found a massive one in the work of a French chemist named Louis Pasteur. Pasteur had recently proven that liquids like milk and wine did not spoil because of the air, but because of microscopic living organisms floating in the air and resting on surfaces. Germs. Lister had a terrifying revelation. If these invisible germs could rot milk, could they also rot human flesh? Lister realized that if he wanted his patients to survive, he didn't just have to perform a good surgery. He had to kill the microscopic monsters invading the wound. He needed a chemical weapon. He found his answer in an unlikely place, the local sewage treatment plant. He noticed that city officials were using a dark, foul-smelling chemical called carbolic acid to eliminate the putrid smell of raw sewage and reduce disease in the nearby cattle. Lister thought, if it works on sewage, maybe it will work on human tissue. In 1865, a young boy named James Greenlees was brought into Lister's hospital. He had been run over by a cart, and he had a compound fracture. This meant his leg bone had snapped and broken through the skin. In the Victorian era, a compound fracture was almost a guaranteed death sentence due to infection. The standard treatment was to immediately amputate the leg and hope for the best. But Lister decided to try his new theory. Instead of cutting off the boy's leg, he carefully cleaned the wound with rags soaked in pure carbolic acid. He bandaged it tightly and waited. Days passed. Normally, the wound would start to smell and the boy would develop a lethal fever. But when Lister removed the bandages, there was no black tissue. There was no foul-smelling pus. The wound was perfectly clean and healing. The boy survived, and he kept his leg. It was a medical miracle. Lister had successfully hacked the biological glitch. But changing a broken system is never easy. When Lister published his findings and told the world that doctors needed to wash their hands, sterilize their instruments in acid, and clean their operating rooms, the medical community laughed at him. Older established surgeons were deeply offended. How dare this young doctor accuse them of having dirty hands? How dare he blame them for the deaths of their patients? They mocked his invisible bugs and refused to change their ways. For years, Lister fought an uphill battle against the stubborn arrogance of his own profession. He traveled, lectured, and performed pristine, sterile surgeries with incredible survival rates, while his critics continued to butcher patients in filthy rooms. Slowly, the undeniable truth of his results began to break through the ignorance. The younger generation of doctors started adopting his methods. They started boiling their tools, washing their hands, and wearing clean white coats instead of bloody aprons. The survival rates skyrocketed. Hospital wards stopped smelling like rotting meat and started smelling like carbolic acid. The era of the butchering art was finally over, replaced by the modern era of sterile scientific medicine. Joseph Lister didn't just save a few patients. His discovery of antisepsis saved billions of lives over the next century. He transformed the hospital from a house of death into a house of healing. Looking back, it is terrifying to realize how long humanity suffered simply because the smartest people in the room were too proud to wash their hands. It reminds us that sometimes the most dangerous glitches in our history aren't caused by a lack of technology, but by human arrogance and an absolute refusal to see the invisible truths right in front of us. So the next time you put a simple bandage on a cut or wash your hands before dinner, remember Robert Liston's bloody apron. And remember the man who fought the entire medical world to prove that the things we cannot see are often the things that hold the most power over our survival. Stay curious, question everything, and I will see you in the next episode of History Glitch.